An assisted living facility nightmare.
A Palm Beach County family says a naked man, medication errors, and other safety concerns led them to contact 5.
They tell investigator Sam Smink they want the Agency for Healthcare Administration to do more.
Very active. She was a dancer, she was a school teacher.
That's before Susan Marks developed Parkinson's. Her daughter Melanie says her mind is still there.
But her physical abilities have declined, and she's had the disease for close to 35 years.
The family put Susan into an assisted living facility, Pacifica Senior Living of Palm Beach County.
We thought that it was a good place.
Melanie says soon after Susan moved in, she learned they weren't following her mother's dietary restrictions.
Unbeknownst to me, after many weeks of her not eating meals, I found out that they had no alternative meal for her.
How often would your mother not eat?
On average, probably 4 times a week.
Then Melanie says things escalated.
She was assaulted by another resident. He would come in and eat my mother's snacks and drink her drinks, and then at some point he became a little bit more assertive in trying to get into her bed. He chased me down the hallway, he grabbed my behind, he attempted to grab my daughter.
Melanie says the man obviously was in need of help, but wasn't being properly supervised. Dawn is Susan's private nurse. She's hiding her face for fear other assisted living facilities will retaliate.
The staff went to the administrator, and she completely ignored everything about the situation. This was a situation where a half-naked man, sometimes totally naked, was walking in and out of my patient's room.
That's when the family says they called the Agency for Healthcare Administration. We found AHCA came to inspect Pacifica in May and June based on the Marks allegations and allegations from other resident families. According to reports, AHCA told Pacifica the resident Melanie told them about needed 24/7 supervision. But AHCA also found insufficient staffing at the facility and a failure to maintain proper records regarding illnesses. We spoke to Pacifica's administrator over the phone. She said no comment. AHCA says they gave the facility the chance to fix all deficiencies before being fined. But after AHCA came in, the Marks family says they started noticing more problems.
Mainly, her medication was mismanaged. She hallucinated, she lost sleep. It was detrimental.
We were able to get copies of the medication administration record. It's called a MAR. And what we discovered was that for weeks at a time, she didn't get her medication, she got incorrect medication.
In September, AHCA came back again to conduct an unannounced inspection and found Pacifica was failing to ensure all residents received medications, as well as other violations.
What do you want the state to do?
It's not what I want them to do for me, it's what I want them to do for the facility and how it's being run, or their lack of.
Sam Smink, WPTV News Channel 5.
And it's important to note the family has taken Susan out of that facility. The Agency for Healthcare Administration has not told us whether it plans to fine Pacifica for not fixing previous deficiencies. We asked Pacifica's administrator several times on the phone to answer questions regarding the Marks' claims and the inspections that we uncovered, and she said several times, no comment.